Good afternoon, everyone. Today, I will be presenting to you the real and raw experiences of intensive care unit and critical care nurse practitioners during this COVID-19 pandemic. As frontline workers, these nurses were confronted with a very unprecedented crisis. A crisis that, it pushed their resilience, their mental health, and emotional well-being, their commitment to the profession and limits of what any human could endure. From October of 2020 to January of 2021, a national survey was conducted that documented the struggles, triumphs, and everything in between of all these nurses and other healthcare workers. The results of the study eliminated what it was like to be a nurse in the ICU during one of the hardest times in healthcare. This article was written to help us understand the experiences of the ICU nurses during this COVID-19 pandemic. It was also used to understand the challenges that they had moved through and how it impacted their mental health and employment stability. Also to identify actions that, are needed to be taken to better support our nurses and to help sustain the workforce in the medical field. The relevance of this study was highlighted by the fact that, there was no national research that had been conducted about the ICU nurses and their experiences during this time. It is important for us to know about all these experiences that these nurses, went through during this time to help form our policies that ensure that the nurses have the support that is required, not only in times of crisis, but all the time throughout their work shifts. Some of the burdens of COVID-19 that these nurses had to face and challenges were they were in extreme emotional distress due to the high mortality rates of COVID-19. They felt hopeless, watching their patients die and fail to improve no matter how hard they tried. One of the most painful parts was watching a patient die alone. Their family was not able to go in and see due to the COVID-19 restrictions. But many of the nurses felt that, it was their responsibility to offer comfort and maybe hold the patient's hand while they passed away. And that was a very hard and painful part of their experience through this COVID-19 pandemic. Another burden, that the COVID-19 pandemic had on the nurses was it resulted in a widespread of physical exhaustion, anxiety, sleeplessness, and a moral distress, just among all the nurses. And whether or not, they questioned whether or not they should continue with being a nurse, or if they needed to find something else. There was a very high rate of burnout during this time. During this pandemic, there was, a few failures in the healthcare system. The nurses felt like they were not supported by leadership throughout their hospital, and many of them mentioned that they felt expandable rather than valued. This pandemic led to an acute shortage of personal protective equipment, ventilators, and many critical medical supplies. There was also a severe shortage of staff during this time. Most of the ICU nurses that were in charge of more patients at once than they were, safe to oversee, when normally it's, maybe 2-to-1 ratio in the ICU. They had 3 or 4-to-1 in the ICU. It was a very difficult time. COVID-19 pandemic, it's a real thing. While we were going through this, when it first came up in 2020, there was lots of people that didn't think that it was, a real thing, or they were in denial about it. One of the most demoralizing features for the nurses was that the public was doubting COVID-19. people had to watch, communities downplay and even deny that this was in existence, while the people in the hospitals worked, every day to save lives due to the illness. And, during this time, some nurses, they described feelings of frustration and, isolation, whether they were wearing some kind of suit to care for patients that had COVID, or, simply hiding behind a mask for months. It went unappreciated for lots of people, and, some people ended up mocking the nurses, and it was a hard time for these ICU nurses to get through. Despite any challenge or things that, you can go through, there was some positive experiences and outcomes through this COVID-19. Many nurses drew strength, because their team had to work together constantly, bonding happened between ICU staff members. It just built a great support system for each and every one of those nurses. Through this COVID-19 experience, a lot of nurses said that they had become better nurses. And through this pandemic, the support that, lots of communities provided to these nurses, it was appreciated when it came in, forms of meals and donations, messages of encouragement, just pretty much anything. It was hard for these nurses to get through this pandemic. The nurses as well played a huge role in this pandemic. They were, a release of information. Much of it was positive, and that seemed to help raise their profiles in healthcare. Most nurses going through this pandemic, they stated that I will never be the same, This was a positive yet negative impact on their nursing careers. Some nurses were actually, questioning their choice to stay in the profession, like I had said earlier. They said that they felt to have been irreversible, but, it changed by the trauma that had been witnessed throughout this entire pandemic. The long-term mental health impact that this pandemic has on these frontline workers, it was hard. And some, it still shows concern now to some people, but not very many. Just, it was a very hard and sad situation for somebody to have to work through. This study here, it shows highlights of the devastating impact that an infectious disease outbreak can have on a population, how it affects the mental health interventions for healthcare providers, and ongoing messages surrounding improved work conditions and the changes at the systemic level in healthcare to avoid extreme burdens in the future outbreaks. This COVID-19 pandemic, it tested the ICU nurses on, their endurance, their compassion for this profession, and resilience. It carried an enormous burden, often without sufficient support. Everybody was also scared of it, so, it was hard for the nurses to get the support that they needed. They were also contending with the stark reality of a strained healthcare system. It was hard. They weren't able to ignore any of their voices. And through this pandemic, most people realized that we must act as a society. Advocacy for better staffing and more resources. Give the nurses the access to the mental health resources that they needed during this time. It was a validation of work that these frontline professionals did every day, because the next healthcare crisis is coming, and it will, we must have better equipment, support, and, protect our nurses. Their well-being is critical, not just for their sake, but, for the future of healthcare itself. we can't afford to, have burnouts like we did during COVID-19. Well, that is it for my speech. I hope you learned something from me today. Stay safe out there, and thank you.